Hello and welcome. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. Excited that you have joined us today for the Song Brown Family Nurse Practitioner, Physician Assistant, and Certified Nurse Midwifery Informational Webinar. Quickly, let's talk about who this webinar is for. This webinar is for new and continuing applicants to the Song Brown Family Nurse Practitioner, Physician Assistant, and Certified Nurse Midwifery programs. The FNP, PA, and CNM, as we call them, programs provide grant opportunities that will result in funding for organizations to educate and train primary care providers to work in underserved communities. And of course, Song Brown is administered at the state level by HCAI. Let's look at the agenda today. We're doing some housekeeping and introductions to begin with. Then we will move into the FNP, PA, and CNM program updates, the application process, and the requirements. Those will be given to us by our program officers. And then we will move into a question and answer session at the end, where you'll have a chance to ask all of your questions. Let's talk housekeeping. The webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the chat and view controls in the menu bar at the top of your screens. That chat feature is particularly important because the chat option will be open to ask questions during the Q&A session at the end of the webinar. So make sure that you can find that and use it. And then this webinar will be recorded and will be available within 7 to 10 business days on our website. And with that, it is my pleasure to introduce Charles Fost, Program Officer for Song Brown FNPPA, to get us started. Charles.
Song Brown provides funding to education programs, including family nurse practitioner, physician's assistant, registered nurse, primary care residency programs, and midwifery programs. Song Brown's statutory priorities are graduating individuals to practice in medically underserved areas, enrolling members of underrepresented groups in medicine, locating the program's main training site in a medically underserved area, and operating a main training site at which most of the patients are Medi-Cal recipients. The e-app registration is open year-round. The applications for FNP and PA, as well as CNM, are open now and have been open since August 12th. If you want to take advantage of our early submission option and have HCAI staff review your application to ensure it is complete, it needs to be submitted before 3 p.m. on September 9th. The absolute deadline for FNP, PA, and CNM application submission is 3 p.m. on September 24th. Everything opens and closes at 3 p.m. Sorry. HCAI doesn't change grant agreements for applicants. Please ensure that your program has approval to enter into this agreement with HCAI before applying. Song Brown funds must be used for the direct education and training of students and to help expand primary care services. They are not to be used to supplant other governmental funds. In 2025, Song Brown will only be taking in data about URM students and not using URM students and graduates for scoring purposes. HCAI needs information to pay your program if they are awarded. Any information that you think we might need to pay your organization is information you should have ready when you apply or have easy access to as you apply. We suggest having open communication with your accounting department or whomever handles your grants as you fill out your application. Your information needs to match your IRS reporting. You will need to know who will be signing all your forms and contracts. You'll need to know information about training sites that your program uses. For instance, the payer mix information for each training site is 1/3 of the score of your application, and you need to know this information before you apply. Know your graduates, especially their NPI numbers. Many programs find it difficult to find their grads' NPI numbers and where their grads are now practicing. Gather that information before applying. Accreditation or approval letters are required when submitting your application. Expanding CNM programs will need their letter indicating the number of approved expansion slots they are allowed to have. Sorry. HCAI has the FNP and PA grant guide, CNM grant guide, technical assistance guide, and Song Brown glossary live on the website right now. The recording for this webinar will also be available soon on the website and on YouTube, where you would find all the other documents. The links to those resources are in the chat. The next few slides we're going to be looking at are for the EAP, registering to apply, and general tips and rules for registration and applying for grants. Please use Google Chrome or Microsoft Edge. Other browsers, such as Internet Explorer, are not supported. If you haven't already, register as soon as possible. If you haven't applied in a while, make sure you still have access. If you haven't applied before, you'll need to go through a two-step verification. If you haven't applied in a while, you might need to go through the same two-step verification that a new applicant does. You will receive an email to authenticate your information. All Song Brown applicants must be listed as an organization for their type. Look for your organization in the search region next to the magnifying glass before requesting a new organization, just to be sure you are already in our system. If you are a new organization, it might take time to be approved. If you are a new organization applying for HCAI grants, we will need your organization name and address. Approving a new organization can take up to 5 days. It is necessary to make sure all the information on this page is correct before submitting. This is our main way of contacting you, especially by email. You will need to request to have a program director role, otherwise you will only have access to the permissions of a grant preparer. Only program directors can start and submit applications. You will need to email songbrown@hci.ca.gov to request to be listed as a program director and have access to initiate and submit applications. If you are a returning applicant but a new program director, please reach out to us to make sure you have the proper permissions to initiate and submit an application. Those with program director permissions can give access to grant preparers to applications that they have initiated, but only the program director can submit the application. To apply for any Song Brown grant, you click on the Apply Here tab and a new page will open. On that page, you can find the grant cycle you are wanting to apply for. In this case, if you are applying for either FNP, or PA grants, it will be the Song Brown Family Nurse Practitioner and Physician's Assistants 2025. If you are applying for a CNM grant, it will be Song Brown Certified Nurse Midwifery 2025. We're now going to go over some helpful tips for the EAP and application. There are 2 buttons you will see on every page of your application, the Save and Next button and the Previous button. There are only 2 ways to navigate through the application. The only way to save the application is to click on Save and Next. The only way to go back to the previous page is to keep clicking the previous button until you get to the page you need. If you need to exit and come back to an application to finish it, your saved application will be on the grant applications page. If you see a red asterisk next to a field, that indicates that this region must be filled before you can move on. The blue circle with a question mark indicates that there is a tooltip available. These will provide you with more information about what is being asked for you to do in that region. The FNP and PA and CNM applications have the same general layout with 2 key differences. We will expand on those 2 differences after the walkthrough of the FNP and PA application. Some of this information will be pre-populated from your profile. It is important to have your profile information set up correctly. If the information on this page is not correct, you will need to fix it on your profile, not on this page of the application. After you make changes in your profile, it will change what is on this page. Some applicants will have both FNP and PA programs. You are allowed to apply for both, but will need to have 2 separate applications. You can only select either FNP or PA on any single application. Look for your training program using the magnifying glass and only select training program not listed if your program is not in the system already. To complete the contract administration page, it is important to have access to your IRS forms. This page must match those IRS forms. If you are an organization that doesn't have a doing business as name, then do not enter any information in the DBA name region. If you do have a doing business as, make sure this region matches what you report to the IRS. partner with whom manages grants with the organization and accounting. This is what we use to write your grant agreements, and that information is pulled directly from what you put on this page. If your grant agreement signatory is the same as your STD 204 signatory, select yes. If it is not, please make sure that all this information you enter here is accurate, as this is used by HCAI to send a grant agreement via DocuSign if you are to be awarded. On this page, we are asking for the address the organization uses with the IRS and should match your W-9. If you are requesting to have payments mailed to an address that doesn't match your W-9, check the box yes at the bottom of the page. This page gives you the opportunity to describe how your program aligns with the mission of the Song Brown program. We also would like you to explain how Song Brown grant funds will benefit the direct training and education of the program students. You only have 2,500 characters, not 2,500 words. If you're going to copy and paste this from a different program, please proofread after you paste it and make sure that nothing was cut off or misplaced during the paste. If you have 23-24 or 22-23 graduates, select Student and Graduate Data. Only select Student Data only if you have no 23-24 or 22-23 graduates. The gap year for this application is 24-25, so we do not ask for information about 24-25 graduates. Training site data accounts for 2/3 of the score of an FNP, PA, and CNM application. Have all this information ready ahead of time. It might take time to accumulate it all. We only want to know about the 5 most utilized primary care training sites where your students cumulatively put in the most training hours. To add a site, click the Add a Site button. Use the Options drop-down to review, edit, and delete a training site. This is the training site entry form that will pop up when you are adding a site. The information required for each training site is the training site name, facility type, NPI number, address, cumulative hours spent by your students, and payer mix for each site. There are links to the HCAI geolocator in the More Information dropdown to search for facility type, as well as a link to the NPI registry. To gather payer mix information, please reach out to the administrative office of each of the training sites that your students use. Do not request more slots than your accrediting body allows you to have. This page is asking for total program expenditures, not just what you would be spending Song Brown funds on. This is for the entire academic year 24-25, all program expenditures. This information is only for data collection purposes and is only aggregate data. We do not need student names. We are looking for total enrollment capacity for all cohorts to be equal to or greater than the total number of students enrolled. The total number of students that applied should be equal to or greater than the total number of students enrolled. This information is only for data collection purposes as well, and we are only looking for aggregate data. We do not need student names. The totals here must match the total enrollment from the previous slide. The information you enter for the number of graduates in each of the years that you had graduates will need to match the number of graduates that you add in the bottom region. Adding graduates will need to be done one at a time. Select the Add a Graduate button to add a graduate. Select the drop-down to review, edit, and delete graduates. For instance, if you have 5 22-23 graduates and 7 23-24, you'll need to add information for a total of 12 graduates. This slide shows the pop-up for when you select Add a Graduate. Only graduates that are practicing medicine in California are scored. If the graduate you are entering is practicing medicine out of state, select No for Do you know where the graduate practice site. The NPI we are asking for here is the graduate's NPI, not the facility's NPI. This page is where you will be uploading your most current accreditation approval letter, which is required for all applications. The correspondence upload is not necessary unless you need HCAI to know something about your accreditation or approval. Your approval letter file needs to start with APPR_ for it to be accepted. Once you click submit, you cannot make any edits. This is final. Go back through the application, make sure all information is there and correct before you check certify and then click submit. You can only go back through your application by using the previous and save and next buttons. Only program directors can submit an application. This page will display after you click submit. It will display your application number and what program you are applying for. To go back to your application to view and print it, you will need to go to your applications and your profile and select the drop-down that can be seen in the right side of the image on this slide. I will now be passing this off to the program director over CNM, Castanina Naval.
Good afternoon, everyone. Thank you, Charles, for your presentation. I am going to go over the two distinct differences that Charles mentioned previously that the CNM application will have. So as previous earlier, the CNM application is identical to the FNP PA application. The only two pages that are going to have a little bit more information is going to be the program information page and the program expenditures and funding page. So in the program information page, you will see a question that says, is your program expanding in the 25-26 academic year? If your program is expanding and it is approved to expand, you will click yes there and check those two boxes next to the statements verifying eligibility. And on the program expenditures and funding page, you will see an option for expanding CNM programs where you can request the maximum of 3 expansion slots in the funds requested section. You will still enter the total expenditures that your program made in the academic year 24-25, including everything outside of Song Brown's awards. Now we're going to go into how FNP, PA, and CNM is scored. So the 3 main criteria for the application is going to be criteria 1, % of graduates in areas of unmet need, which is 25 points, % of main training sites in areas of unmet need at 25 points, and average payer mix of main training sites up to 25 points. For training sites, we're looking for up to 5 training sites with the most cumulative hours. So I'm going to run through an example of a program and their scoring. So in this example, criteria 1, the program has 50 total graduates, 20 of which are in areas of unmet need, practice in areas of unmet need, giving them 40% of their graduates practicing in areas of unmet need. We would take that percentage, multiply it by the total number of points possible, and then give us 10 points. So this program would score 10 points for criteria 1. For % of main training sites, they have 4 training sites they provided, 3 of which are is in an area of unmet need. And then we would do the same thing. 75% of their training sites are in areas of unmet need, multiplied by 25 total number of points. And this program will get 18.75 points for criteria 2. And the last scoring criteria will be payer mix of your training sites. And this is going to be average. So for this example, this program had 3 training sites. Each of their payer mixes are going to be totaled and then averaged out between all of the training sites. So for this particular program, they had an average of 64%, and then that 64% will be multiplied by the total number of total possible at 25, giving them 16 points for criteria 3, and then all 3 of those criteria will be added together, and that would give this example program 44.75 points out of 75. That wraps it up for us. I'll hand it back to Chris to go through our Q&A.
All right. Thank you, Charles and Cassidy. As you can see, our team has put a lot of work into this program. We're excited that you've joined us today to learn more. We're now going to transition into our question and answer session. The menu bar at the top of your screen, you can find the access to the chat feature where you can type your questions in the chat. We're going to do our best to get through all the questions today in the time that we have, and we do have plenty of time today. We do ask that if you have super specific questions that are regarding personal circumstances, to email our team. Also, if you realize that tomorrow morning you wake up and you had a question that you didn't get to answer, you you can email us as well. The email that you would use is songbrown@hci.ca.gov. And in the chat, we've posted all of those resources. You have the individual program pages, as well as links to the grant guides, the funding portal, and the email, as well as the application submission dates in there. And so with that, let's go ahead and jump into any questions that you have. The chat is open. Give me a thumbs up if everybody's able to access the chat. Up in the top there, hit the react button and hit thumbs up. Make sure that everybody's chat is working so we know that we're not having a tech issue. Got a thumbs up there. Thank you. Anybody else have access to the chat? All right, there we go. Elizabeth has a question for us. We have traditionally had a 2-year master's FNP program, but we'll now have a 3-year FNP program. Do we use the same program name or do we need a new one? Thank you for that question, Elizabeth.
You'll be using the same program name. You do not need a new one.
All right, thank you, Charles. Other questions today? Are there differences in how we enter things now that it's a 3-year program? Asks Elizabeth.
No, you're going to be entering the same way, the same information.
Thank you for those questions, Elizabeth. Just a reminder, you can find the grant guide and the websites, program websites in the chat. If you haven't had a chance to look at those yet, I highly encourage you to read through the whole grant guide. We also have the technical assistance guide program posted as well. It's very similar to what we went over in the webinar today. I'll remind you that we are recording this webinar. We will be posting this and this morning's webinar on our webpage as well. So if you have a coworker that wasn't able to attend either webinar, in 7 to 10 business days, we'll be able to have that posted and you can have them watch that. Any other questions today? Nancy says, I missed the first 5 minutes. What type of information is given in the 2,500 characters on the program?
We're looking for a description of your program and also at least a brief description of how the HCAI's funds will benefit your program. But really just kind of a basic breakdown of how the program fits within the mission of the Song Brown program.
All right. Thank you, Nancy, for that question. One of the things we wanted to emphasize as we give you some time to think about any other questions that you have is the importance of the early submission review date, September 9th by 3 p.m. That gives you an opportunity to have the team go through your application and make sure that there's nothing missing and that everything is in order. Gives you a chance to fix everything before the final deadline on September 24th at 3 p.m. So we highly encourage you to take advantage of that early submission date. I'm going to give everybody another minute or so to get any other questions you might have today. We do appreciate everybody joining us today. We've had between this morning session and this afternoon session, we see some familiar faces, and it's always good to see people coming back. 30 seconds here if anybody has any questions that they want answered today. Again, if you think of one tomorrow or anytime during the application period, you can always email us at songbrown@hci.ca.gov.
Chris, I just wanted to do a brief little information here. Chris mentioned before that we have resources linked in the chat. Please check out that technical assistance guide for the respective programs. They, just like the webinar, will have screenshots directly from the application, and they will be in order of how they are in the app. So if you wanted to preview what's going to be on the application, what we're asking for, you can check out that TA guide on the website and see what kind of things you should expect to see in the app. And then, like I said, like Chris said, all those resources are on the website and linked in the chat right now if you wanted to view them. Our website is also linked in the chat for where the webinar will be posted in 7 to 10 business days. But I just wanted to make sure, highlight that the TA guide is a great resource for all of you to see the application before you jump in.
Thank you, Destiny. I just want to make sure nobody else has any questions. Give me a thumbs up if you all got your questions answered for today, and we'll know that you guys are ready to move on. All right. Fantastic. Well, thank you all for your participation with us today. We really appreciate you being here. Again, songbrown@hci.ca.gov for any future questions that you might have during the application period. We do appreciate everybody joining with us today to learn more about our Song Brown, FNP, PA, and CNM programs. We're excited to be able to offer this as just one part of our health workforce program development efforts at HCAI. And we encourage you to go to the website and see all of the other things that we have going on if you are not familiar with all of our other programs. We also invite you to join us on social media. Find your favorite platform here. And when you are doing anything HCAI related, we would love for you to give us a hashtag and drop a hashtag in your post and let us know about the great work that you're doing there. One of the best ways for you to stay up to date with us is for you to sign up for our monthly health workforce newsletter. You can do that by going to this URL here, or you can hit the subscribe button at the top of our webpage. And as you fill out your information there, make sure that you check one of the health workforce topics in the selection boxes there, and you will be added to our monthly mailing list to stay up to date with all of our health workforce offerings. You can always contact us via phone or email, and we'll be happy to help you. Just want to remind you again that we have that September 9th at 3 p.m. Early submission review date, and the program does close September 24th at 3 p.m. Thank you so much for attending today. With that, we do conclude today's webinar. We hope you have a wonderful day.